Hi there, I'm Dr. Marie Fang. Welcome to my video series featuring quick tips and tools to help you be your best self today. Today's quick tip is all about how to sensitively suggest that someone seek out therapy. This is a sensitive topic. I frequently get calls and emails from people asking me, you know what, my loved one is the one that really needs help. How can I convince them to see a therapist? And of course, this pretty much always comes from a place of love and care. Say, I want what's best for my loved one. Or it could be somebody that you're mentoring or caring for otherwise. And I just don't know how to bring this up to tell them that they should see a therapist, or I've already brought this up and they keep declining. The first piece is to be mindful of your timing. So you want to pick a time that this person is more receptive and open, because most often we keep to ourselves the importance that somebody might benefit from seeing a therapist until we hit the end of our rope. So maybe if it's our spouse, it's when we're in the depths of an argument and we just can't handle this argument anymore. So we say, you know what, you just need to go see a therapist. That's what not to do. Don't do that. But that's what we do. So we need to shift it and say, you know what, mental note, this is beyond my limit for helping this person. They would really benefit from some help. Let me watch for a time when they seem calm, when they seem receptive, and bring it up then. The next tip is when you bring it up, be sure to ask permission, meaning, you know what, I have something kind of sensitive to bring up with you, and I'm kind of looking for a good time to do that. I'm wondering, is now a good time, or is there a better time that I can bring this up with you? That way you're putting some power into their court where they can say, oh, I am busy right now, or I don't want to have this conversation right now, but maybe we can have it this other time. So you're letting them know this is going to be something important that we're talking about. I want to pick a good time to do that. And then certainly follow up if you ended up putting it at a different time on the schedule, because chances are they won't bring it up unless you bring it up. And then check again. You know, you said this was a good time. Is this still a good time? It's okay to move it again. That's how we work as people. So when that time comes, when you bring it up, be gentle, and most importantly, be sure not to use blaming or shaming words. So what we want to do is focus on behaviors you've observed in the other person, the ways that they've been affected, and it could certainly include ways you've been affected or their loved ones maybe have been affected if that's something that's been coming up. So we could imagine an example of saying, you know what, I've noticed over the last days, the last weeks, months, years, however long, you know, you've been having a lot of trouble getting out of bed in the morning, and I see how painful that is for you and how there's something that's going on that's making it difficult for you to focus on life right now. And I've been trying to be supportive and to figure out a best way to help you, and this, that, and the other that I've tried. I see that they're not really being helpful, and I'm concerned for you, and I want to help you. I wonder if it might be time to consider seeing a therapist who might be able to help you more than I can right now. So that would be a great example of just sort of naming, here's what I've observed. It seems to be affecting you a certain way, and maybe also it might be affecting me, or might be affecting your other loved ones, your kids, your spouse. And so maybe it might be time to consider seeing a therapist, right? So it's a gentle way of bringing up something that's still quite sensitive. And the person may be receptive, which is great. It's also possible and likely that they will say no, or they'll be defensive. And you know what? That's okay, right? So you did your part. Sometimes it takes people a long time to go from benefit and being in a space where they could benefit from seeing a therapist to actually deciding that they're going to go see a therapist, and pushing them to do it or forcing them when they're not ready is not going to help them. And if anything, it'll just make them resent you more for it. So bringing it up is really what's in your power, and then leaving it to them to make that decision if that's the decision that's best for them and that they choose to make. So that part of it is out of your power, and that's the beauty of each of us having control of our own lives in that sense. And the pain for you to watch them do it. I know how that goes. Well, that concludes today's quick tips. I hope you found this helpful. If you like this video, don't forget to subscribe for more like this one. And until next time, I'm Dr. Marie Fang, and I hope you have a great day.